Welcome to today's webinar and welcome to the fall season. With the end of the year quickly approaching, this is a great time to start making good on that promise that you make to yourself every year to get your HR house in order before the new year starts, and especially before that super busy season going into November and December, this is really a great time to focus on this. So whether you're joining us live or you're catching the playback of this recording, I'm really glad that you've tuned in, because today we're going to be going through real HR scenarios that we see day in and day out and discuss really the root of many of these problems, and then maybe more importantly, how to fix them to proactively lower your risk level before it really becomes a problem. And I know many of you on this webinar probably dislike the topic of HR, and I don't blame you. I get it. There are so many other things that you probably would prefer to focus your time on, and not to mention, HR is hard. Humans are messy. We are complex beings. We have needs, wants, emotions, stress, you name it. And that, in addition to laws constantly changing, it can feel almost impossible to keep up with it all. And it's much easier to ignore it until you absolutely have to deal with anything. But the reality is, HR really isn't a part of a practice that can be ignored anymore. You know, you can see in this stat, lawsuits have been and continue to rise each year. Wage and hour lawsuits are a really, really big issue. We'll get into that in a bit of how to avoid those. And employees leaving the practice not only create a situation where you might be at risk, because that's, you know, at the time of termination, whether they're quitting or you're firing them, it can open up a can of worms of what happens next now that they're no longer employed with you. But it also impacts the main driver for all of you, which is patient care. And so what we're going to go through is the 5 mistakes that we see. We're really kind of looking at what I'm going to say the low-hanging fruit, kind of the non-negotiables of what have to be in place just as a foundational aspect of your HR. And so we're going to look at these top 5 mistakes and pairing those with real examples that we see commonly before practices start to work with us, when maybe they don't have systems or processes in place, or buttoned up systems or processes in place. And then we will leave time, hopefully at the end, for Q&A. Please feel free to submit your questions through the chat or through the question feature in the webinar platform. And if you are not able to get to your question, or we're not able to go through it today, we will definitely follow up with you. So don't think that there's any stupid question. If you have it, the others on this call probably do too. So let's jump into it. Our first HR mistake is not having an established process when it comes to recruiting, hiring, and onboarding. And so this is the first scenario that we see very commonly. This specific one is a hygienist refers her friend to help at the front desk, and you bring her on board quickly. The job duties were discussed informally, and she signs a few standard documents, forms, but there's really no formal job description outlining expectations. A few months later, she resigns, she files for unemployment, claiming that the role was misrepresented, and without clear documentation, that person is unable to challenge the claim, and it ends up costing money. So how do we avoid this? First and foremost, hiring and onboarding is absolutely your best opportunity to start on the right foot with an employee. Not just from the standpoint of building a healthy working relationship, but really from the compliance standpoint. This is your chance to start things right, start things clean, doing things by the book from the beginning. And we know many of you are recruiting, and while we're not going to go in depth on the recruiting side today, I do want to mention, first and foremost, if you're looking to hire, take a look at what your online presence is. This is absolutely a way to attract applicants that you want. The people that we're hiring, those Gen Zers, the ones that the new generation coming in, they are looking at your online presence. They're looking at your social media, your website. Does your website even say that you're hiring? Does it have the presence of your team? Does your social media showcase if you're doing events in the community, or if you have an employee appreciation day, are you really representing yourself as a true brand that will make people want to apply to work with you? And if this is something that you don't have, we have a ton of recommendations of who we trust in this space. Wondrous is a great company that does beautiful websites that can help you with making sure that you are attracting the right people. And again, you have a really clean presence that showcases who you are. So don't overlook that step. And then you want to look at how you're prioritizing and standardizing a solid description of the role, and understanding how to have what I'm going to call a kosher interview process, because all of these pieces are helping to build a strong onboarding experience, which significantly boosts the likelihood of retaining that employee. So first step here is start by conducting a comprehensive assessment of your current team. So identify the roles and responsibilities that each of your team members currently fill. And if you're looking at these bullet points and you haven't done any of these yet, or maybe you've kind of thought about it, you are not ready to hire. And I don't mean that you don't need a body in the office, that you don't need a team member to come in and help with workload, but you just haven't done the homework yet to make sure that person and your existing team are set up for success. So evaluating the workload distribution, taking notes of any areas where additional support or specialization might be required is really important. Examining your daily workflow, so understanding your patient load, appointment scheduling, peak times, identifying those bottlenecks or areas where your current team might be stretched that's leading to gaps in creating a great experience for your patients. So this is going to help you to determine kind of what schedule like you need to fill. The other thing to look at is what skills and specializations within your existing team do you have, and where do you have gaps that are hindering the practice? So this could be in a clinical area, this could be in an administrative duty area. It's really important to make sure you're considering the comprehensive view of your practice and making sure that you're well equipped to serve patients in the best way possible. So for example, you might be thinking that you're looking for a dental assistant, but you might realize your office also could use help with inventory management. And so in this instance, finding somebody with specific experience in this area would be really valuable. Also, technology is evolving, so consider the skills and qualities that's going to be essential for the future success as you're bringing in and adapting to these industry trends, changes, patient expectations. Really bringing that into your hiring strategy can make for this to scale much easier. Again, especially as you bring in new technology, or maybe you already have state-of-the-art technology. That's really important for your new people coming in to have some sort of relevant experience with a modern practice. The other thing not to miss here is engaging with the existing team members. This helps you to get their insight on their workload, their challenges, area where they feel like they might need more support. And what we do see a lot is that when this step is missed, that can create a situation where there's friction right from the beginning when a new team member comes in, because your existing team doesn't really feel like they're clued in. They don't see the full picture of what you're trying to do. So having that collaboration can really help. Of course, looking at budget and again, what's needed in terms of this new person that you're hiring. And then you're going to compile all of your findings into kind of an assessment, into a document. This is going to serve as the foundation for creating this job description. So kind of think of it as a rough draft, and then your job description is going to be the formal kind of end product that has cleaned that up. And the job description is, I think, one of the most underutilized, yet one of the best tools that you have in your arsenal. We a lot of the times think, well, these employees have worked at other practices. They have experience, but they haven't worked at your practice. They don't know your exact expectations. And so this is where the job description comes in, because it's going to contain the functions and requirements for a position. So at minimum, a job description for any role should include the job title, a summary of the position, what the classification is. So are they hourly, are they salary? We're going to get into that a little bit more in a second. The core job responsibilities, what the required qualifications are, work experience, and then do you have minimum requirements for certifications or licensures? And so when we look at this, you're going to use this job description to also develop your interview questions. And you want to use the same questions for each candidate for consistency and to be able to do an easy comparison. The job descriptions, starting with this before somebody's even applying to the practice, if this is what you're using to post your role, you're using it to help guide the questions that you're asking through the time that you hire them, and then you're giving them that job description again on their first day of hire so that they see that through line of, again, the consistency, the transparency, the expectations that you have for them really helps to create a good experience. And then one thing to note here, another really important part of a job description is the essential functions. So the essential functions section of a job description is basically what's saying is essential for that role to be completed. So a lot of you might be familiar with some legal jargon. Every time a law is passed, it seems there's always a little section in there that says you have to do this unless it would create undue hardship on the business. And that's where these essential functions come in, because if an employee is asking for accommodations, there's a disability situation, pregnancy leave, and you're sitting there going, well, this really is going to impact my practice, you're going to look at those essential functions section to help guide you with help of an HR professional if you find yourself in that situation. But that's really going to help guide what can be accommodated and what cannot. So just making sure that you don't overlook that section, and you just don't overlook job descriptions in general, because they're a great compliance tool and also really, really helpful for the hiring process. So you're not just looking like, all right, I found somebody, I barely know them, but I just need a warm body, I'm bringing them in. This helps to whittle it down a little bit more to know if it's a good fit. And when you're ready to start interviewing, when you find those applicants, start with a phone screening and act quickly. Of course, you know, the labor market is hot right now in all of our industries, and so it's important to not just sit back and wait. Start with a phone screening. This is a basic conversation of, here are hours of operation. Can you work this? You know, this is a full-time position or a part-time position. These are the days of the week that we're open. Tell me a little bit about yourself. And then you're going to schedule in-person interviews if that phone screening goes well. And this is where it's really, really important that you're preparing questions in advance and that you're asking the right questions. So you want to be focusing on their skill, their talent, character, fit on the team, what's their employment history, what is their relevant experience for coming into the practice. And make sure that you are, again, asking questions in the right way. So the goal is to ask open-ended questions to understand their experience, their perspective, if they know how to do the things that they need to do, the way that your practice prefers to operate. Situational approaches are really good. So saying, here, this is an example, pretend I'm a patient, this just happened, describe how you would handle it. And so it allows you to kind of see them in real time of how they would handle that, like on the spot of how they would speak to a patient about a certain situation. And this image here is a representation of kind of what questions not to ask and how you can ask those instead. So the first one of which religious holidays do you observe? Instead, you're saying, are you able to work the required schedule? Again, another way to say this is, we are open on December 24th and December 25th. Does that work with your schedule? So it's not going into the direction of any information that you don't want to know or shouldn't be gaining that could be construed as you're making a decision to maybe not hire that person for reasons that are protected classes. And if your team is involved with hiring, please make sure that they are also trained on how to ask questions. And again, you want to ask the same questions to each person, document their answers in case there were ever any questions about why you didn't hire somebody. So once you do find those people and you're ready to bring them into the practice, or even if you have an existing team and you're not really looking to hire, reflect on, did you do these things initially when you brought these team members in? And if not, some of them you should absolutely do now from a compliance perspective, but also you can start to set these things in motion even with your existing team, and I highly recommend that you do. So it's really important to set the tone for your practice right from the jump. So when you are bringing somebody new, remember that you only get one chance to make that first impression. And with the way the labor market is, we really can't afford to lose new employees because there's confusion or frustration the first day on the job. So it's really important that you take your onboarding process seriously to make that great impression, and think of it like you're providing a new patient experience. What's that experience that you're hoping to create when a new patient comes into the practice? Take that same amount of care and time with a new team member. And setting those expectations from the beginning is really important as well. So this is done through the onboarding process. Again, remember, your new hires might have experience elsewhere, but they've never worked for your practice. So what should they expect? What's their first day going to be like, their first week? Make sure you're communicating where they're going to park when they get to the office. What are they expected to wear? Who's going to greet them? What's their day going to be like? So it really does start even before they walk into the office. Do not forget to have them fill out their new hire paperwork. This is absolutely one of the biggest misses that we see. On average, there are 12 to 15 new hire documents that you need to have your employees fill out and sign on the first day. We typically see, before we start working with a client, we see they have about 3 to 4 new hire documents. So you really want to, this is what I was mentioning of for your existing team, this is something you want to get in place ASAP. Again, this number is average. If you're in a state like California or New York, we're pushing 20, 22 documents at this point. Other states, it might be a little bit less. So this is something you definitely don't want to overlook. And going into the new year is a great time to get that updated, because as laws change, these documents tend to change as well. Your employee handbook should also be included in this list of documents. We're going to get into that in a little bit more in depth. And make sure you pay them for this time. Even if they say, hey, send me everything before my first day, I really want to hit the ground running, you do have to compensate them for the time they fill out and sign these documents. We recommend you have them come an hour before they actually are going to start doing, I'm going to say, productive work. On the first day, have them sit down. If you have this in a digital way, ideally you do. If not, you should talk with HR for help for sure. But if you have them sit down, get through all of that the first hour, and then have them start their day. Making sure that you're setting the expectations. We hear a lot, my employees won't clock in and out for lunch, or they're working overtime. This is a great time to set those expectations of, we take an hour lunch every single day. It's from 12 to 1. Everyone stops working. You are to clock out. This is what you're supposed to do. If you're not able to clock out because of a patient, like, be really explicit in what your expectations are. And then making sure that you're, again, reviewing that job description, they're acknowledging it, and you're following up regularly. We recommend at least 30, 60, 90 formal check-ins that are documented, even if the person's doing great, to set them up in that normal cycle of feedback and transparency. And then from there, at least minimum once a year, you should be doing a review. We recommend doing it on the anniversary date. I know some of our clients like to do it all at once at the end of the year. I definitely think there are some downsides to doing that. One, just that's a lot of work for you when it's already a really busy time. So why not spread it out throughout the year? But make sure that you do have that communication, that transparency right from the start, because that's going to really help. And again, if you're not doing these things right now, there's no better time than the present to start to do this, even with your current team, getting their documents in place, talking about your meal and rest break schedule, reviewing the handbook, doing these check-ins. Maybe it's not 30, 60, 90-day check-ins, but maybe it is every 90 days for the first year until it becomes normal. All right, our second mistake is missing or outdated employee handbook. So here's a scenario we see. You run your optometry practice for years with the same loyal team, but now you're growing and things are changing. new hire complains about unclear sick time rules, and when you try to enforce the policy, they push back. You pull out your handbook only to realize it hasn't been updated for quite a long time, and it still lists things that don't even apply anymore. So the purpose of the handbook is to have formal documentation that serves as evidence of compliance. So again, it's not a legal requirement to have an employee handbook, but it is legally required to have many, many, many policies in writing for your team. And that's where the handbook comes into play. It's setting these objective guidelines for your expectations. So think of the job description as the individual expectations. The employee handbook is kind of the constitution of the office. It's the expectations across the board for everyone. It really helps to act as a legal deterrent almost. This is your first line of defense. We hear when attorneys are coming with employees to sue employers, if they see that you don't have an updated handbook, one of the most basic parts of HR, what do they ask? Well, what else don't they have in place? And that's where they start digging. So this is definitely one of your first lines of defense there, but it also is creating consistency. It's promoting that consistency because all situations should be handled objectively and in the same manner. This helps to avoid inadvertently discriminating against any of your employees, whether you're conscious of it or not. And it, again, creates that transparency. Every employee should have access to your employee handbook whenever they need to. It needs to be signed. And this is the way that you're communicating to your team what is expected. So keep that in mind. And I also want to give an example of, we saw this in August of 2023. So about 2 years ago, there was a company called Stericycle, and they found themselves in the middle of a lawsuit related to their workplace rules, AKA their employee handbook. And the lawsuit was based on allegations of unfair labor practices. So basically what happened there is their employee handbook had not been updated since 2015, so almost 10 years. And the way that the policies were written, they were essentially perceived as activities that should be protected for their employees. But the way that the policies were written, the courts deemed that it was infringing on employees' rights around what they're allowed to do in the workplace. This was specifically around forming unions. Now, we are not in industries where unions are common, and Stericycle actually isn't either. But because the way that their policies were written, that basically discouraged employees from being able to engage in certain activities that are just their right, that ultimately could lead to creating a union. Again, even though nobody was creating a union, this became a big issue, and Stericycle just had no idea. And so the policies specific for this ruling that you want to look at is limiting use of personal electronic devices in the office, and what they can say on those personal devices, email usage, employees about, taking pictures, video, audio, talking about their wages, all of that, and saying you prohibit it can lead to a lot of issues. So these policies need to change. If you do have anything in place that prohibits employee behavior that actually is within their right as employees, this is a great time to be looking at that and making sure your policies do not say that. And really, in general, as you're reviewing your policies, asking yourself, is this rule I have in place appropriate? Is it necessary? Can I draft this a little more narrowly? Am I just saying they're not allowed to do anything ever? Or is it, too broad? That's an idea, or that's an indication that it probably could use some updated. And then reviewing your policies and handbooks to make sure that nothing could be interpreted by employees, again, as something that is within their right to do. So restricting their use of social media, criticism of the office publicly, being retaliated against for if there's an investigation or complaint. All these things are something that you definitely want to look at. Outside of that, let's say your policies there are great, but you're using handbook templates, or you're not updating your handbook in other areas. And you can see this example of why that's such an issue. we hear so commonly before clients start working with us that they got their handbook from a friend, a colleague, and then they edited it to fit their practice's needs. This is a big mistake. You don't know where that handbook came from. You don't even know if that handbook is compliant in the first place, and then you're trying to tweak it to your practice. So there's a compliance issue, but also just, again, like a cultural thing about it. The handbook is the constitution of your practice, how you want it to function. So you want to make sure that you're keeping up on that and updating it at least once a year. These are some example policies of a framework of things that you absolutely, again, kind of non-negotiables that you should be having in your employee handbook. And the reality is we have to tell our employees exactly what we expect of them. I know that that's crazy and I hear it all the time, like, Jill, they know that they aren't allowed to be late. Okay, yes, but did you tell them that? And are you holding them accountable if they are? Have you defined what it means to be late? Is it 5 minutes after their start time? Is it 1 minute after their start time? Is it if they clock in anything except right on the dot of your start time? Like, you need to be super clear about this. And then also making sure that you have knowledge of what your own practice policies are if you have to use them. So for example, jury duty, that's something that comes up pretty randomly and sporadically. Do you know your jury duty policy? Does your employee know your jury duty policy so that you can handle it appropriately? And it's not just important to have them written down. Probably the most important part, again, in your action item from this is actually following them in practice and not just saying, here's this document, but I'm not actually going to do what I'm saying I'm going to do. So think of the thing that bugs you the most. Is it cell phone use? Is it issues with dress code? Again, is it tardiness? Like, that list could go on and on. But the point is doing that reflection and then comparing these gaps you're seeing to the policies you have. And are you explaining your expectations and then holding your team to what you have in writing? So, and again, making sure all employees have access to this, they've signed off on it. Reviewing and updating your handbook at least once a year is really important. And again, now is a great time because you can actually get yourself set up for going into 2026 with all the law changes that are coming down the pipeline. And again, if a policy is outdated or it's just not working for you anymore because you've grown, you're in a different place now than when you first wrote that handbook, revise it. Revise those policies so that they work for you. All right, wage and hour and overtime compliance. So again, this is one of the biggest issues and pitfalls that probably the most risk that exists in your practice right now. So here's our scenario. Your assistant sometimes stays late to clean up after last patients, just a few minutes here and there. You figure it balances out over time. But one employee starts logging every extra minute worked and then files a claim for unpaid overtime. Now you're digging through time cards and emails trying to explain why your payroll doesn't match your actual labor laws. So we know that overtime is one of your biggest headaches. We hear it all the time. It's super frustrating. And a lot of the times, the way that we try to hold our team accountable about overtime is by not paying it, because we say, well, my policy says I don't pay authorized overtime or unauthorized overtime. And the reality is it doesn't really matter. This is a trap. If an employee says you don't have to pay them overtime, you absolutely do. And you want to make sure that all of this is documented. But where this really starts is how we're classifying employees. So the first thing we have to ask is this person an independent contractor or an employee? And this, again, is one of the most crucial parts of starting yourself off on the right foot or cleaning this up if maybe you are finding yourself in this situation right now. It can result in doing this wrong, can result in really big fines, really big problems. And so when we look at the independent contractor side of things, we want to look at really a few things. The first is, what's the level of control? So how much control do you have over how and when that person completes their work? If the answer to that is barely any, then you might be good to go to classify that person as an independent contractor. If you have complete control over when they see patients, what patients they see, when they are able to take time off or not, you're making their schedule, you're telling them exactly what to do to complete their work, probably not an independent contractor. There's also a level of financial control. So if the worker is dependent on the practice for payment, reimbursement, those sort of things might not be, you might have too much control over that person and they might not be able to be an independent contractor. Also, is there a set date of when your relationship with them ends? If you're giving them benefits like insurance or vacation, that could be an issue. And then it's really, again, the length of the relationship. So it's hard if an employee relation, or if a relationship lasts longer than a year consistently. Sometimes this can be an issue with classifying them as independent contractors. The caveat I will say here is that with the new administration coming in, they're kind of trying to roll back some of what the old administration did. We are kind of in a waiting pattern here to see what this is going to look like. So my recommendation is always erring on the side of caution. Our rule of thumb kind of is typically the most common person that passes the test is an associate. Anybody else, clinical employees, assistants, hygienists, opticians, front office, even if they work in other offices, even if they're part-time, even if they're temporary, they most likely are an employee because you have control over what they're doing. So once we've established that somebody is an employee, we then have to decide or understand, is that person a non-exempt or an exempt employee? So again, in a practice like yours, it is very rare that multiple positions are able to pass as an exempt role. Our exempt employees in the office are employees that make at least double minimum wage and they get the same salary every single payroll. But more important than that, it really is based on their job duties. So do they manage more than one employee? Do they have autonomy in how they work? Do they have business making decisions, hiring, firing? What I'm describing here is probably like a true office manager within your office. Again, a hygienist, unless they're a lead hygienist, unless you have 50 locations and there's lots of level of hierarchy there, don't really pass as being exempt. And so if somebody is not exempt in the office, which again is going to be most of the employees that you have, then that means they are non-exempt, meaning they are not exempt from overtime and receiving lunches and breaks. So again, this is kind of where the first glaring pitfall we see is assuming, well, I just pay all my employees on a salary, so I don't have to worry about calculating overtime. I don't have to worry about them clocking in and out. And that's just not true. If somebody is non-exempt, they have to be clocking in and out. That is your legal responsibility as an employer. You have to have time records for them. They have to be earning overtime and they have to be taking meal and rest breaks, especially if you're in a state where that's a law that you have to offer that. So when we look at overtime again is owed to all non-exempt employees. So the federal rule of this is that overtime is paid to employees who work over 40 hours in a work week. So that means Sunday to the following Saturday or Monday to the following Sunday. Your work week can be what you want, but it's not based on the pay period. You're not looking at 2 weeks of time and saying, well, did they work more than 40 in this? Your calculation has to be based week by week of what they work. And then make sure you're aware of, if you're in a state, there are states that have daily overtime. So California, Colorado. So just make sure you're aware of that. And then just pay attention to any risky pay structures like per diem. So like I mentioned, you can, if you're paying an employee a flat rate, let's say you're paying them per day or per patient, it's okay if you pay them that way, but you do have to have them clock in and out so that if they go into overtime, you are aware of that and you're able to pay them overtime based on that per diem amount. So if you're using an outdated time clock, your practice management time clock, something like that, this might be tough to track. HR for Health does do this for you. That's why we were built for practices like you, because we understand you pay per diem, percent production, percent collection, but just don't miss this if employees are not clocking in and out. And if you're sitting here going, I don't have everybody clocking in and out, talk with us. We can help you to fix that so that you're protected moving forward. Also, if an employee works under more than one rate during a work week, so if they have a training rate, or they do 2 different roles, and so you pay them 2 different rates for that, you do have to do a weighted average calculation to make sure you get the correct overtime rate. It's basically a blended rate of those 2 rates, or you can pay them overtime at the higher rate of pay. So let's say you pay them $30 an hour for certain things, $20 an hour for others. You have the option to always pay overtime at the $30 an hour. So again, this is something our system can do for you if you're in a situation where this is happening. Also, if you're offering bonuses that are non-discretionary, meaning an employee does X to get Y, they know what they're doing to earn that bonus. It's not a bonus where, hey, I'm feeling nice today, here's $100, and the employee's going, wow, that was nice, but I have no idea what I did to deserve that. A non-discretionary bonus is they know exactly how they are working towards that bonus. And that's the logic of why these bonuses have to be considered when running overtime and when doing that calculation, is because that employee is working towards that bonus while they go into overtime. So again, we actually have an overtime webinar that I did a couple months back. So if you're interested in that, it goes really in depth into all of this. But if you're in this situation, you don't have a time clock that helps you with this, definitely talk with us. We make sure it's super easy. And again, as a matter of policy, if employees have to work overtime, you should be telling them in writing and then holding them accountable of what they should do if they have to go into overtime. So for example, internally at HR for Health, for a long time, we had a policy where if somebody had to go 10 minutes into overtime, it didn't require approval. Anything more than that did require approval. We were really, really clear about that, made it easy for the employee to know what they were supposed to do. So again, remembering non-exempt employees must be paid for every minute that they work. And if we're looking at the meal and rest breaks, this is at the federal level, anything from 5 to 20 minutes that's a break needs to be paid. Anything that's 30 minutes or above can be unpaid. They should be clocked out if it's uninterrupted. So if it's not, I'm eating lunch and I'm answering the phones, that's not an uninterrupted break. But if they're truly away from their desk and they're doing their own thing, absolutely have them clock out for that time. Again, we recommend scheduling lunches as clearly as possible. In our scheduling software, you can actually do that for the team so they know when they're supposed to take their meal and rest breaks, and it's really, really clear. If you're in a state that requires meal and rest breaks, or one or the other, if it requires rest breaks, which is definitely really common, make sure that you're tracking the fact that you're offering that. In our system, when somebody goes to clock in, they get a little banner that pops up that says, you are offered a rest break today. Don't forget to take it. If you're unable to take it, notify your manager immediately. So that's something that runs, and again, that's state specific depending on what that looks like, but you want to make sure you're protected there so an employee can't say that they weren't offered that. Really do not recommend using time clocks that round up or down. We are seeing a lot of case law starting with that. That is not going in the favor of employers and going in the favor of employees. So you really want a time clock that counts it down exactly accurate of when they clocked in and out. And here's kind of a little cheat sheet of, if you're going, I'm not really sure what my time clock does, here are the questions to ask yourself or look into for your time clock. So are all employees able to clock in and out? Meaning employees that aren't just paid an hourly rate, if they're per diem, percent production, percent collection, whatever it might be, are they able to clock in and out? Does your time clock system understand what it means if a person isn't just paid an hourly rate? Those rounding rules are not in place. Overtime is automatically calculated based on the state that you're in. Absolutely, employees are not prevented from clocking in and out based on scheduling rules. Similarly, clocking in and out is not automatically done based on scheduling rules. This is the quickest way to have an employee say that they're being forced to work off the clock, and then making sure that everything is stored and maintained should you ever need to pull it. Other things that I'm going to say are, I think they're non-negotiables, but I guess are technically nice to have, is that your timekeeping and your time off are connected and integrated. So as employees work, they accrue time for their time off. It has that meal and rest break tracking in there. And then if you're using a biometric timekeeping system, this is also a kind of word of caution. We are also seeing case law in multiple states around employee personal data being collected. So with these privacy laws that have been rolling out kind of across the country, it's now creating issues with biometric timekeeping. So it's not always a great idea to have that in place. Another huge one, having time off policies that carry risk. So in this scenario, you've always handled vacation time informally, just let us know when you're taking time off, but an employee quits suddenly and demands payout for unused PTO, and you realize nothing was ever documented. It wasn't in their offer, it's not in a system, it wasn't really written, it's just one word against the other, and now you're having to write a check to pay that out. So we know that PTO, sick, vacation is one of the most confusing topics for all of our clients. Even it's something that we help them with on a day-to-day basis of understanding what is the requirement in your state, what are the laws around it, is it more beneficial for you to have a sick and vacation policy or a PTO policy that lumps all of the hours in together. Again, we did a pretty in-depth webinar on PTO a couple months back. Again, if you're interested, please reach out. We'll make sure to get that to you. But you want to make sure that this is really, really clear. Asking yourself a few questions if it's not clear for you right now. First of all, am I doing sick and vacation, or do I have a PTO policy that lumps everything in together? Then you want to ask yourself, how is it earned? Is it earned based on calendar year, or is it earned based on their anniversary year? We highly recommend anniversary year if you have the right systems in place. Doing it off of calendar year can be easier for everybody that was there on January 1st. But when you hire people throughout the year, it gets confusing of what's prorated. New hires don't understand it. You might not understand it. So we do recommend doing it on anniversary date. Also asking, are they going to accrue hours, meaning as they work, they earn their hours, or am I going to give it to them all up front for the year at once? Again, we highly recommend accrued, so they're earning it as they work. It might seem like lump sum can be a little easier, but if you're in a state where use it or lose it isn't allowed, or you have to pay out hours at the time of termination, or you're just concerned with employees taking all their time off right at the beginning of the year and then still taking days off later in the year, you run that risk with lump sum. But with accrual, you just need to make sure you have a really clean system so that they're accurately accruing what they're working. Then asking, when can the hours be used? Is it 90 days after they start with you? Is it they can't use vacation for the first year that they're with you? Is use it or lose it allowed? Can you dictate the timing of when they use their hours? Do you want to do that? Do you shut down for a month in July and you want to ask them that they use their vacation time during that time? You can do that. It just needs to be in writing. Also asking yourself, what are my parameters around when I'm able to deny them taking vacation? Do I need them to request it to me a month in advance, or else I'm going to deny it? Or is it 2 weeks? Is it 3 months? You get to dictate this. You just need to make sure it's really clear and in writing. And then, of course, how is it tracked? Do you have the systems in place to be able to support what you want to do in terms of what you're offering? Because what I can tell you is that when we start working with a client, one of the first things that we see is they have one thing in writing in their handbook, and then they're doing something completely different in terms of what they're actually tracking and accruing. And it makes sense. Like, these policies evolve. You might negotiate a specific thing with a specific new hire to try to get them to come on board. Maybe they get more vacation, or again, things have just been developed over time. You want to make sure that exactly what's in writing is what's tracked in a system. Those two things absolutely are connected. And again, do what you say and say what you do. If you want to make sure multiple employees from the same team don't request time off at the same time, establish a first come, first serve policy. Some of our clients do a seniority policy where it's like, the longer you've been there, if you request time off, you're going to be guaranteed basically that time off. You get first right of refusal, or it's first come, first serve. It's totally up to you. It just needs to be thought through and put into writing. And then making sure if you are parting ways with somebody that your final paycheck includes all those owed hours. This is so important because a final paycheck is really kind of the end of the end. That paycheck should have everything that you possibly could owe to that employee when they leave the practice. And so our system, like and hopefully the payroll system that you're using, we have a final paycheck option which pulls in bonuses, vacation time, whatever it might be that is owed in that final paycheck to make it really clean. And this is again where it's important to invest in the right systems early on, because you don't want to be scrambling by the time that final paycheck comes around, not knowing what hours were worked, what's owed, because you didn't make sure everything was clean leading up to that. It should be super clear when a final paycheck comes into play what should be in there. And if it's not, you should probably look at having some cleaner systems. Also, this is a callback to the employee handbook as well. Make note that there are some states that if you do not have anything in writing about what happens with unused hours, then you have to pay the employee out for it. If your policy says you do not pay out those hours, then you don't have to pay for it. So that's not every state, but it is common. And so these are the little nitty-gritty things that you want to make sure you're aware of so that you're doing this correctly. Again, regularly reviewing and updating these policies. If they're not working for you anymore, just change them, but then make sure your employees are aware of it. They understand what the policies are, you understand what the policies are, and you're ideally using technology to just address it. All right. Mistake number 5, what I love to call the at-will conspiracy. So our scenario here is a front desk employee has been late 6 times in 3 weeks. You've talked to her verbally, but never documented anything. Eventually, you let her go, assuming at-will protects you. A month later, you're served with a wrongful termination claim, and without written warnings or consistent documentation, it's your word against hers. So we hear this all the time. Jill, love everything that you're saying, but I'm not really worried about it because I'm an at-will state, which means I can fire somebody at any time I want for no reason, and they can quit at any time they want for no reason. That's not the reality. It is now more than ever super important that if you part ways with an employee, you have documentation building up to show why you fired that employee. So with this example of the tardiness, if your time clock doesn't know what it means to be tardy, if there's no like scheduling logic in there, it's going to make it that much more cumbersome to try to gather that data if you're having to prove that's why you let somebody go, versus if you have a system that's flagging it every single time that they're late, it makes it so much easier for you to be able to prove that. Because again, remember, you might not have fired somebody for any other reason than the fact that they were tardy 3 times in a short window. But if you don't have that documentation and they bring a claim like that's a discrimination claim, meaning they fired me because of insert the blank, that's up to you to then defend yourself to say, well, no, I actually fired them because of this. And if you don't have that documented, that's where it gets really sticky and it becomes he said, she said. So verbal warnings are definitely a great place to start, but you also want to back that up with documentation. I can tell you that our HR team, when a client calls us and says that they want to terminate somebody, the first place our HR advising team looks is in our client's account, in that employee file, in their violation section. And we look, do they have any write-ups? Is this going to be a huge surprise to the employee? Or maybe, again, you've had conversations, but there's nothing in writing. And then we coach our clients on how to make sure that that's in writing so that it's really, really clear. This is the other thing, is that you should be documenting everything. Even if you have your favorite employee, really strong performer, you love them, and they violate your policy and you're not writing them up, but you're writing up somebody else for doing the exact same thing of violating that policy, because that employee you don't really like, they kind of annoy you, they call out a lot, it does not look good. So you need to have that consistency across the board. This is why the job descriptions are so important. The employee handbook is so important. These are going to be your anchors of what you're using to refer back to, of saying, look, this was super clear of what I told them the expectations were, and I'm documenting this to show that they were out of bounds of what I expected of them. And again, this doesn't mean that you're always documenting things with termination in sight. We started this webinar talking about how we're trying to keep people. We need people. We're trying to hire people. It doesn't have to be looked at as like a negative thing. If you're creating that transparency of feedback and consistently having informal feedback sessions, more formal performance reviews, things are consistently documented, it makes it that much easier to just have it be a normal thing. Also, making sure that you are being objective in terms of what you're documenting. So another example that has come up with us from, I will never forget this, I was talking with this doctor who really wanted to fire this employee. He was looking to become a client of HR for Health, showed me some of his documentation, and all of his documentation, he had written her up, but he was using words like slow. And this employee was over the age of 60. And so that documentation actually was risky, because the documentation was kind of reflecting, yeah, I'm having issues with her being slow, which could be connected to her age. So that's why it's really important to get help when you're doing this and make sure that it's as objective as possible, talking with our team to be able to do that. I'm giving you all a bonus mistake that we see here using Google. It doesn't just have to be Google. It can be ChatGPT, those Facebook groups that I see where everybody's asking each other HR questions to their peers, and the stress it gives me of some of the recommendations I see in there. Please don't Google questions. When you, again, our HR advising team, when somebody calls in and says, I want to do X, Y, and Z, we're asking like 10 follow-up questions to gain enough information to make sure that there is protection for you in the decision that you're making. So the point here is, if you don't even know how to ask the question correctly, or I shouldn't even say correctly, but if you don't know exactly what details are needed to make sure there's a full picture of the scenario, you're already setting yourself up for ChatGPT to maybe give you some generic canned advice. And so it really does need to be with an HR professional as you're getting these questions that come up. So please, please, please don't use Google. Again, now is the time to stop those ways and start the new year by having these trusted resources. Again, you even being on this webinar is a great step in the right direction, because this is how you get like credible information to make sure that you are doing things correctly. So as we look to wrap up, what comes now? This, I think, is a perfect image of really how we need to look at HR. It's starting with a good foundation of the employee handbook, making sure your timekeeping is in place, performance reviews, benefit compliance. You want to have a full, well-rounded team and compliance strategy. And this does take time. You know, the phrase is, the best day to plant a tree was yesterday, the next best day is today. You don't want to wait. Again, we are a proactive solution. We want to avoid issues happening to you, and if they do happen, that it makes it go away very easily and it's really clear. And so we did actually just roll out a new HR risk assessment quiz. This actually can help you kind of go through self-service of asking or answering some questions to see like where your risk level is at in these different areas. And so if you're not sure kind of where you stand or are just curious, this is a great place to start, because it does look at a lot of the different sections that come into HR and making sure you're managing those correctly. So if you scan that QR code, you can take that. Also, again, we'll send that link out on email as a follow-up as well. As we close out, please let us know if you have any questions. I'll let Jasmine kind of chime in to see if we have any. But if you, in general, are just curious about how these things can be cleaned up, please feel free to reach out to our team, book a demo. We can walk you through the platform. Again, we were built for a dental practice, an optometry practice, a vet practice. We are built for what's going on in your day-to-day. So we are here to help however we can. Jasmine, I'll chime back in with you.
Yeah, we do actually have a question from Heather. I know I answered it in the thread, but just so everyone else gets it as well.
Yeah.
So Heather asked, the 20 to 29-minute period in breaks confuse me. How do we handle it if someone only clocked out for 28 minutes? So she's in Georgia State, and she believes requires payment for anything less than a 30-minute break. She's using ADP currently for their time clock, but she's not sure if it'll auto pay them for time that's less than 30 minutes.
So I'm not sure on the functionality of ADP in terms of if it will automatically pay them for the time that they should have been for that break. I, off the top of my head, do not know the specific law around Georgia. So Heather, let us research that, and
Oh,
with our HR team, I'll get back to you. Oh,
I
you already
did
answered it.
actually,
Oh, great.
I did actually reach out to our HR team once that came out, and
Oh,
they let me know that Georgia's requirements aren't different than the federal requirements on that front. So they don't
awesome.
have
Thank you.
anything additional saying that like it's anything over 30, under 30.
Awesome. Thank you. Any
And
other ones?
that's the only one I'm seeing in there. If no one else has any other questions, I think that's all.
Awesome. Well, thanks everybody for joining us. Again, if you think of questions later, please reach out. Our team is happy to answer those, get you answers really quickly. And we look forward to seeing you soon. Stay tuned. Going into end of year, we're going to be doing a lot of end of year prep planning, law updates, information. This is a great way for you to stay in the know of what's coming down the pipeline for you.
Awesome. Thanks so much, Jill. And thanks for joining us, everyone.